Greetings and welcome to another edition of Medical Update. I'm your host, Walt Culbertson, and today we're continuing with a two-part series on one of the fastest growing infectious diseases in America, Lyme disease. As promised also in our last show, we do have a new website. Go figure, it's medicalupdateshow.com. We encourage you to visit that and not only share your ideas and stories, but also learn more about today's topic and others that we're going to have on the show throughout the year. In our first part of this series, we basically set the stage by talking about the fact that you're healthy, you're enjoying the beautiful surroundings that we have in Jacksonville, but all of a sudden, out of the blue, you start to experience pain, fatigue, numbness, brain fog, and you're at a loss as to what's happening, and challengingly, get that out, so are your physicians, and so they're having challenges as well. We had on our first show Ms. Shirley Hartman, one of our area leading CEOs who very unfortunately is confronting this disease. We also had the president of the Northeast Florida Lyme Association, Ms. Amy Boggs. They set the stage for today's very important show where we're going to talk to two of our folks who are on the front lines of this disease here on the First Coast. We're very honored to have with us today Ms. Shirley Hartman, a local practicing physician who treats Lyme patients. Welcome to the show.
Thank you.
It's very nice to have you, Dr. Hartman. And we also have with us today Dr. Kerry Clark of the University of North Florida, who's doing very important research and is an ally to physicians in the area with regard to helping them determine when Lyme disease is present, and hopefully, as we're going to hear today, some of the things that he is doing to help us take steps in the right direction. Welcome, Kerry. Thank you so much for being here today.
Glad to be here, Walt.
Very good. So, as we heard from Julie, you in fact are her doctor.
Yes.
Yeah. And so can you kind of explain how Julie came to find you and what you saw in that first interaction with Julie?
Well, Julie had a fairly abrupt onset of illness, which included problems with numbness, tingling, brain fog, fatigue. She was seen by a neurologist and had an extensive workup, and no real underlying cause was found. And she was referred to me, and in testing her for Lyme, I definitely found evidence that she had antibodies to Lyme proteins in her blood, and she really did have excellent improvement with a multifaceted treatment approach. So it's encouraging when you can identify something that has an underlying cause and do specific treatment that can help affect improvement and better quality of life.
Very good. How much of your practice is devoted to the diagnosis and treatment of Lyme disease?
Probably half of my practice right now, and most of my new incoming patients have Lyme.
Well, that's incredible that half of your practice is devoted to this. Are there other physicians in the area or Northeast Florida that have similar practices?
I would say not. There may be other physicians that are open to the idea of Lyme, but I wouldn't say that they are aggressive in diagnosing and treating it.
So kind of explain that just for a second, open to Lyme disease and what that means.
Well, there's a huge controversy in the Lyme disease arena. There are experts who say that, including Infectious Disease Society of America and the Center for Disease Control, who say that Lyme is relatively easy to treat. It's very easy to diagnose. They have clear-cut guidelines on what constitutes a diagnosis of Lyme, and they say that generally a short course of treatment, say a month of IV antibiotics or a month of oral antibiotics is sufficient to produce a cure. And then on the other side of the controversy are some physicians, experts, and a great many patients who say that their Lyme symptoms were not cured after a short course of therapy, and that Lyme can be very challenging to diagnose and treat, and that Lyme can go chronic. So there are infectious disease doctors in town who, if someone meets the CDC criteria, will treat with a month of IV therapy. And then I have one patient who actually met those criteria and had that month of IV treatment, and then she relapsed after the end of treatment. So, you know, of course, we are amongst the people that say that Lyme is difficult to diagnose and difficult and sometimes long-term to treat.
Mm-hmm. As I've been reading, and I think as Amy shared on our last show, there's much thought that Lyme isn't in this area. And I guess, Dr. Clark, from all your research and going out and finding ticks, you're very much seeing that that's not the case.
Absolutely, Walt. I've been studying Lyme for over 15 years, and in Florida for about 12 years now. And one of the first things I did when I got here was to begin to collect ticks at sites throughout North Florida and doing DNA testing on them to look for the presence of the Lyme bacteria, and began finding it very quickly. In fact, I found Lyme Borrelia at almost every single site that I've ever tested any fair number of ticks. So if I've tested 100 ticks from a particular site, then I've found Lyme Borrelia in at least one of them. And so we know the organism is here. It's in the wild animals that serve as the natural host for the bacteria, and it's in ticks widely spread throughout the state of Florida as well as other southern states. So there's no question that the organism is well established, and it's been here for a very long time.
Now, does Florida have the kind of environment that attracts ticks? Are there high populations of ticks? Because I think in some of the research I did, I kind of saw that they really don't like dry climate. They kind of come out and move about when it's moist and damp. Go figure, here we are at that time of year, right?
Exactly.
We all drove over here in a rainstorm.
Well, the thing about Florida is it has a great environment for ticks. In fact, in the different southern states that I've done work in, which includes South Carolina and Mississippi and Georgia and Florida, I found higher overall populations of different species of ticks in Florida than any of those other places. And it's the warm climate, it's the tremendous diversity of animal hosts that ticks can feed on, and various other features of the habitat that make it very conducive to ticks. And they are active year-round because of the warm climate. Some species of tick will be active all year round in Florida. So we don't have a tick season in Florida. We just have times of the year when you're more likely to encounter one species of tick versus another species of tick. But they're a year-round risk here.
They're very seasonal. And so unfortunately for us, we're one of those species that ticks like to host off of.
They have no problem feeding upon people as well as other hosts. They're happy to latch on to us, and they will try to take a feed if we give them a chance.
So is this something then that our pets and our animals can also contract?
Absolutely. Pet animals, particularly dogs, can also acquire Lyme disease. Horses can acquire Lyme disease infection. And it's well documented that some of these animals also can develop chronic, persistent infection. And sometimes when they're treated, they recover. Sometimes they recover for a short time and then relapse. So we see some of the same patterns of the chronic disease with the animals as when we look at people. And so our pets are exposed to these things, and people are exposed. And interestingly, pets often bring ticks closer into contact with people. If they go outside, they can bring ticks in. So sometimes people get ticks on them, and they never even went outside if their animals went outside.
Well, Dr. Clark, clearly your research is showing they're here, they're prevalent, you know, unlike other places, especially up north where, you know, they have very harsh winters. Obviously we don't. So I think we have a year-round very unfortunate opportunity. And so in light of that, Dr. Hartman, why do you think more physicians, you know, don't have the appreciation that it's here? And, you know, we've got wonderful research being done by Dr. Clark, and so the evidence is there. 50% of your practice is dedicated to these types of patients. So any thoughts to what we need to do within our medical community to sound the alarm?
Well, first off, when the Infectious Disease Society of America puts out guidelines on how Lyme should be diagnosed and treated, and the facts about Lyme that perhaps don't match research, that information is propagated down to physicians. For instance, a year ago, I got my family practice update CD on Lyme disease, and what the infectious disease doctor speaking had to say was that it's largely confined to the northeastern United States with some extension down the eastern seaboard. There's another hot spot in the northern Midwest, and then there's also Lyme in California. So basically negating that there can be other areas of the country that have Lyme disease. So physicians are told that if someone doesn't live in those hot spots or have exposure in those hot spots, they can't have Lyme.
Well, that just doesn't seem logical. I mean, and as physicians, you go to medical school, a big part of what you do is around logic and reason, and to me, I'm sorry, that goes against both.
Yeah, I really don't understand how there are border guards that keep the ticks from traveling back and forth. And in fact, it's been shown that ticks hitch a ride on birds, songbirds, who have paths that migrate right down the eastern seaboard from the hot spots up in the northeastern United States. Those songbirds carry ticks to the south. And as Kerry's research shows, Lyme does occur here. And I don't know that Kerry pointed out, not only does he do testing for Lyme DNA, but on some of those samples, he will send off a representative subset to be DNA sequenced. And as far as I understand, every time that you've sent that off to be sequenced, you've had some sort of Lyme DNA, some organism of Lyme was in the DNA sequencing.
We're not getting false positive results.
No, so what that says is when he's getting positive results, it's accurate because he has corroborated it with DNA sequencing, and there's just no way when it matches 99.7% of the DNA pairs that you have a false positive. So, if someone is going to try to shoot holes in, whether we really have Lyme here, are his tests accurate? They are.
Right. Well, how is a patient diagnosed? What is, and I think we talked, and I read something about a Western blot.
Yes.
What is that?
Well, blood is drawn and checked for 10 long-term antibodies to Lyme and 3 short-term. Excuse me. The first step is normally to do an antibody screen. And it's generally considered that you first do the antibody screen. If that's negative, you don't go any farther. If it's positive, then you do a Western blot. So a Western blot is looking for antibodies to the Lyme proteins. According to the CDC's website, which also says Lyme is a clinical diagnosis, they say that reportable Lyme is to have 5 of these long-term IgG bands out of 10, or 2 of these short-term IgM antibody bands out of 3. And that if there's a positive screen and then one of those 2, that's considered a reportable case of Lyme disease.
What's meant by long-term and short-term?
We have antibody that's like a first responder kind of antibody, and then there's a long-term antibody that persists for years after that. So both short and long-term antibodies are tested. There are also some of the bands or these antibodies to Lyme are Lyme specific. That is, as far as we know, nothing else mimics that. Nothing else will create a false positive. And then there are some of the bands that are not Lyme specific, that are shared by other organisms. So if someone has a Lyme specific band and it's current antibody and they have symptoms, as far as I'm concerned, that's a diagnosis of Lyme.
So tell me about the symptoms. What symptoms are initially exhibited and then maybe over time?
Well, there's often a classic presentation where someone is well and then they suddenly develop problems. Well, I call it pain, brain, and lame. That's my mnemonic. So if they have problems with pain, nerve pain, numbness, tingling, joint pain, if they have brain symptoms, cognitive dysfunction, memory impairment, brain fog, perhaps other brain things, Alzheimer's, Lou Gehrig's, multiple sclerosis, Parkinson's disease, that's considered under the brain. And then lame, rheumatoid arthritis and other rheumatologic and joint kinds of problems. So a classic onset would be when someone is well and then they abruptly develop, like a flu sort of illness, fever, achiness, and then they never quite get over it. And they go on to develop sort of chronic illness like people who have chronic fatigue syndrome and fibromyalgia. There are some people who have no abrupt onset. They have a sort of a gradual onset, and over the course of months to years, they develop these sorts of constellations of symptoms. So in my practice over the last couple of years, I've been checking Western blots on people and corroborating some of those samples with Dr. Clark. And in the spectrum of people who have chronic fatigue syndrome, fatigue, chronic pain, fibromyalgia, disc problems, rheumatoid arthritis, lupus, multiple sclerosis, Parkinson's, Alzheimer's, Lou Gehrig's, I test those people in my practice for Lyme, and 75% of them come back with at least one antibody to Lyme. 85% of them may show evidence of a Lyme co-infection on Dr. Clark's testing, or they respond to treatment. So if truly 85% of the people in that pain, brain, lame category actually have Lyme, what we would be dealing with is an underground epidemic that's in denial.
So do you think that Lyme could be causal to those other types of illnesses?
Yes, I think that Lyme can be. Now, and that's not to say that every one of those people that have all of those problems have Lyme. I'm not saying that.
Right.
But I think that it's possible that a sizable proportion of those groups really have Lyme disease.
Now, you mentioned that you actually take samples and pass them on to Dr. Clark.
Yes.
Dr. Clark, what do you do with them then at that point?
I focus on doing DNA testing, so I've developed some really sensitive methods for trying to identify Lyme Borrelia DNA in human blood samples. It's mostly human blood samples. I also get tick samples from people and test those as well. And then I will also screen them for other co-infections that are very common with Lyme, such as Babesia, Bartonella, some other things like that. And what I'm finding the most often are Lyme and Babesia, very, very common co-infections. And so many people have more than one tick-borne infection at the same time, which is probably complicating their disease course, their treatment,
and
recovery, and possibly diagnosis as well. I mean, we know the tests for Lyme are not very good right now. The clinical lab tests that are based mostly on antibodies are very poor in sensitivity. So that initial screen test that Dr. Hartman recommended a minute ago, it probably picks up maybe 25% of people who actually have Lyme, and there's a good bit of evidence in the scientific literature to show how poor it is in sensitivity. So in terms of a two-part testing strategy, it's extremely poor. You really want a super sensitive test at the beginning.
But isn't that what the Western blot was supposed to be?
Well, and so the Western blot, as the second part of that testing strategy, is supposed to be the one with the specificity. So you use ultimate sensitivity first, then you come back with the more specific test. But apparently the Western blot is much more sensitive because it looks for multiple antibodies that you might have against different proteins of the organism. You have a better probability of picking something up with the Western blot.
And it seems those multiple bands that Dr. Hartman talked about.
And as she mentioned, some of those bands represent antibodies against very specific proteins to the Lyme organism. And what people need to understand is that even when you show one of the not so specific bands, when it's in the presence of some specific bands also, then that may mean more. The other thing we have to understand is that sometimes people don't show the very specific bands, and sometimes people only show the specific bands later on if they've been tested 2, 3, 4 times. And a lot of patients aren't ever tested that many times. And another weakness of the testing, if you have to do a test 5 or 6 times before you finally get evidence of what you actually have, that's not a very good test.
Right. So there's some cyclical nature to this that would cause it to not show up early, but then have Dr. Hartman show up later?
Yeah, well, I would say that there are several reasons why someone might have Lyme and still not test positive. If someone is extremely ill, they have an overwhelmed immune system, they have multiple co-infections, Lyme itself produces neurotoxins that impair immune function. And Lyme also has the ability to lose its cell wall and go intracellularly, so it can hide inside the cell. If you go on YouTube and type in Lyme forming a cyst, you can see under a microscope a spirochetal Lyme organism over a couple of seconds walling off into a round spherical cyst. And that also impairs any ability to produce antibodies. In order for us to produce antibodies, we have to have an antigen or a protein that's in the body fluids, not behind a cyst wall, not within a biofilm or a honey-like goo that the bacteria produce and can hide in, and not inside a cell, not inside a cyst. Secondly, you have to have immune competency in order to build those antibodies. So some of the very sickest of the sick Lyme patients have bacteria that are hiding out and an impaired immune system such that they're not able to form antibodies. There's also antigenic drift. We have multiple organisms that fall within the spectrum of Lyme disease. Borrelia burgdorferi is the classic, but Borrelia afzelii and Guerinii are in Europe, and there are even others, Borrelia andersonii and others, that have been shown to cause disease.
So then what you're describing is it's not only the great masquerader, it's the great hider.
Exactly.
It can actually hide, and so our body can't react to it in the way that it should, and as
Exactly.
over the course of mankind, our bodies have been able to do miraculous things. But if it can't spot it and can't form those antibodies, then that could be indeed part of the challenge. And is that part of your research, Dr. Clark, and what you're trying to discover from
Well,
some of
the
what
main
you're doing?
things that I'm working on right now are very basic, and that's just trying to identify how much Lyme is actually out there in the human population, in ticks, in wild animals, and trying to determine what different species of the Lyme organism are actually out in nature and causing disease. And so, for example, if you go to the CDC's website or you read most of the scientific literature in the United States, they mention only one species that causes Lyme disease in the United States, and that's Burgdorferi. I've found 3 different species in human patients who are very, very sick. Many of them have been chronically sick and haven't published that research yet, but there's no doubt that multiple species are causing disease in the United States, just as they are in Europe and other parts of the world. And so I think the more research we do, the more we're going to find that some of our tests aren't working so good also because the tests are designed to identify a single species, and we have people being infected with different species that are probably genetically different enough that it affects the test results.
Right. It was initially thought that Lyme was carried by the deer tick.
Yeah.
So then I guess what you're describing is there are other species that...
Well, first of all, there really is no such thing as a deer tick. This is another piece of misinformation that I want to correct. There is actually no such thing as a deer tick. There is something called the black-legged tick. And that is the species that we have in the eastern United States that transmits Lyme disease, no question. No one debates that. But it's been called the deer tick for so many years that people are now referring to it as the deer tick. It's really not. It's called the black-legged tick. But I am finding Lyme borrelia in other species of ticks besides that one. And for example, there's a species called the Lone Star tick that bites people a lot more commonly in the South than the black-legged tick.
I'm assuming in Texas?
That's probably where they named it after. One of the stages has a single white dot on its back, and so they called it the Lone Star for that reason. But it's an extremely aggressive tick. It bites people in all of its different life stages, and I'm finding Lyme borrelia in those ticks. And I've actually documented Lyme disease in people who have been bitten by those ticks, where I've gotten a positive result in the tick and I've gotten a positive result in the patient. And so I think it's only a matter of time before we can show very conclusively.
That is there. Well, Dr. Hartman, how many patients come into your practice with a tick or have any knowledge that they've even been bitten? Is it possible that a tick could have landed on me, did its thing, and I either didn't know it or brushed it off? And is there any other symptom of the tick bite that we can kind of look towards that would exhibit, we've got a challenge coming?
There are people who come into my practice that think they have Lyme or have been diagnosed with Lyme, and then there are my pre-existing patients that I test. And most of the pre-existing patient population that I have, of my patients that I've had for years that test positive for Lyme, have no history of a tick bite. Some of the ticks that can transmit Lyme can do so in a nymphal stage, where that tick is about the size of a poppy seed. So if someone were to have a bite from a tick, say on the back side of their body or on their hairline, and the tick is the size of a poppy seed, they might never know that they had a tick bite. So I really don't use or require the history of a tick bite or even exposure, because some people don't have any history of tick bites, or they may not be outdoors people. So, you know, I don't make any exclusions on the basis of tick exposures,
So you
because I
start
think
with that
everybody...
clinical diagnosis of them presenting themselves with various, it sounds like one-to-many symptoms, and
Yes, I go
and
by their
from there.
symptoms and test on that basis rather on the basis of tick history.
Well, that's a key for other physicians in our community, I would think. You know, just because a patient walks in, doesn't you know or hasn't been aware that they were bitten, but there's still a nice protocol that you've kind of developed in your practice with that clinical diagnosis, followed up by the testing that you do, the initial screening and the Western blot. So it sounds like those are some good guidelines for physicians in our community.
Yes.
Very good. So, Dr. Clark, we have a few minutes left. Can you kind of describe what the goal of your research is and what you hope to have as an outcome from that, and who funds your research?
The primary goal of the research is to seek the truth of what is going on with various tick-borne diseases in the southern United States. And I want to know what species of disease-causing organisms are out there, how often people are being infected, what ticks are transmitting them to people and their pets, and just do some genetic work on that, a little bit more of the genetic analyses. And another big part of the work is simply education, is trying to educate the general public, healthcare providers.
Do you work with other providers besides?
There are
Dr.
other
Hartman?
healthcare providers in the state as well as outside the state of Florida that I do collaborate with regularly. And I even work with patient advocates around the country, because I want to work together to try to improve the conditions with this problem.
And so the research that you do, is that part of a foundation, or?
Yes. Right now my funding all comes from private donations. We have a UNF foundation, and a specific segment of that is a research foundation account for my work. And people are able to donate to that
And how do they find out more information?
They can either go to the Northeast Florida Lyme Association. They can go to the website there and find a little bit of information. It's pretty easy to find me on the internet, actually, as well, and people are more than welcome to email me or call me at the university, and I can direct them to the development officers who handle those matters. I just forward those inquiries to them. Good. And they manage that.
But we'll also make certain that we take all of your information, and we'll get that
Sure.
up on the Medical Update Show website. So we'll do everything we can to help you in your cause. And
Thank you.
As we close, Dr. Hartman, some advice for patients and physicians. I mean, obviously we can't prevent from being bitten. So quickly, can you just tell us, do you have a website, or can they get in touch with you, or what should they do?
I have a website, mandarinwellnesscenter.com.
Okay, we'll also put that on our show's website.
And what I would say is that if someone does have a tick bite, that they should be treated with doxycycline and something to break up cysts, metronidazole, and that people who have chronic illnesses in the pain, brain, and lame category should be tested for Lyme with the Western blot.
Good deal. Well, we'll definitely get both of your websites. We'll send folks your way, and can't thank you enough for all of the tremendously important research you're doing, the help that you're giving to patients, and again, anything that we can do to be a part of that. Well, this has been another edition of Medical Update. Again, we encourage you to come out to our website, medicalupdateshow.com, hear more about this important topic and others. And thank you so much for sitting in and watching us this evening. And we're wishing you wonderful health, and enjoy the great area that we live in, ticks notwithstanding, in Jacksonville. Thank you.